Hello, friends. If you or someone you love is getting close to needing nursing home level care, do not assume the only next step is moving into a facility. Pause for emphasis. There is a Medicare and Medicaid-connected program called PACE, and for some older adults, it may help coordinate medical care, social support, prescription drugs, transportation, adult day services, and home-based support while the person continues living in the community. But I want to be very careful from the beginning. PACE is not available everywhere. It is not automatic. It does not mean every senior can avoid a nursing home. And it does not mean you can call today and be enrolled tomorrow. The reason this matters is simple. Many families do not hear the word PACE until they are already in crisis. A parent falls. A hospital discharge is coming. A spouse is exhausted. A doctor says the words nursing home level care. A social worker starts talking about long-term care, and suddenly the family feels like they have only one choice: move into a facility, or somehow keep struggling alone at home. Before you make that decision under pressure, I want you to write down one question. Is there a PACE program in our area? That question does not guarantee anything, but it can open a door many families never knew existed. PACE stands for Program of All-Inclusive Care for the Elderly. In plain English, it is designed for certain older adults who need a nursing home level of care, but who may still be able to live safely in the community if the right medical and support services are coordinated around them. That phrase is the key: coordinated around them. PACE is not just one benefit. It is not just a ride to the doctor. It is not just a nurse visit. It is a coordinated care model where a team looks at the person's medical, physical, emotional, and social needs and builds a care plan. Before we go further, if you are not subscribed yet, hit subscribe and turn on the bell. Rules around Medicare, Medicaid, long-term care, prescription drugs, caregiver support, and senior benefits can be confusing, and families are not always personally told what to ask before a crisis happens. I break these issues down in plain English so you can check them before a costly decision is made. Now let's go step by step. Number 1, know what PACE is and who it is really for. PACE is for older adults with serious care needs. It is not a general senior discount program. It is not the same as casually picking a Medicare Advantage plan during open enrollment, and it is not a simple home care coupon. To even start the conversation, there are 4 basic eligibility questions. First, is the person at least 55 years old? Second, does the person live in the service area of a PACE organization? Third, does the person need nursing home level care as certified by the state? Fourth, can the person live safely in the community with help from PACE? Those 4 questions are the gateway. Not every Medicare beneficiary qualifies. Not every Medicaid beneficiary qualifies. Not every person over 65 qualifies. And not every county has a PACE organization. The service area question is often the deal breaker. 2 people can have the same age, the same health needs, and the same Medicare and Medicaid status, but one may live inside a PACE service area and the other may not. So do not ask only, does my state have PACE? Ask this: does a PACE organization serve my zip code or county? Then ask, what documents do you need to determine whether my parent meets the nursing home level care? Requirement, that is the practical question. Not rumor, not guessing. Not a neighbor's story. You want the local PACE organization or Medicaid office to tell you whether the address and care needs fit the program. And here is the part many families miss. Needing nursing home level care does not always mean the person must immediately live in a nursing home. For some people, if PACE is available and the person qualifies, care may be coordinated in a way that supports community living. But do not turn that into a promise. PACE does not erase every risk. It does not mean every person can safely stay home. The person still has to be assessed, approved, and able to live safely in the community with PACE support. Number 2, understand how Medicare and Medicaid work with PACE. This is where families often get confused. PACE is connected to Medicare and Medicaid, and many PACE participants have both. When a person has both Medicare and Medicaid, PACE can coordinate services through one care model instead of forcing the family to chase separate pieces of care in different places. For someone who has Medicaid, there may be no monthly premium for PACE. For someone who has Medicare but does not qualify for Medicaid, costs can be different. There may be monthly premiums connected to the long-term care part of the PACE benefit and prescription drug coverage. So never assume the cost is the same for everyone. Here's the question to ask. If my parent has Medicare, Medicaid, or both, what would the monthly cost be under this local PACE program? Ask that plainly. Ask them to explain what Medicare covers, what Medicaid covers if the person has Medicaid, and what the family would be responsible for if the person does not qualify for Medicaid. Also ask this: if PACE approves a drug, service, or care item, are there deductibles, copayments, or coinsurance for that approved care? The important word is approved. The PACE care team determines what services are needed under the care plan. That does not mean every service a family wants will automatically be covered. It means the team reviews what is necessary to improve or maintain the person's health. If you disagree with the care plan, ask how reviews, appeals, or complaints work. Do that before there is a crisis, not after everyone is upset. Number 3, ask what services could actually be included. Many families think long-term care has only 2 choices: pay privately for home care or move into a nursing home. PACE can be broader than that. Depending on the person's needs in the local program, PACE may involve primary care, prescription drugs, home care, adult day care, transportation, nursing services, meals, therapy, social services, dental care, mental health counseling, hospital care, and nursing home care when necessary. That does not mean every participant gets every service. It means the care team looks at what the person needs. So do not call and ask only, "Do you provide home care?" Ask a better question. What services could be included in a care plan for someone with these medical needs? Then describe the real situation. Do they need help bathing or dressing? Are they missing medications? Have they fallen? Are they going to the emergency room often? Are they isolated? Can they get to appointments? Is the caregiver exhausted? Are there memory problems? Is the home safe? Are meals becoming a problem? Lower voice. And if you are the adult child or spouse doing the caregiving, do not hide how hard it has become. Say it clearly. My parent wants to remain in the community, but the family is struggling to coordinate care. What would the PACE assessment look at? That is not complaining. That is useful information. Caregiver burnout is not just a feeling. It can change whether a care plan is realistic. If one exhausted spouse is doing all the lifting, all the medication reminders, all the transportation, all the phone calls, and all the overnight worry, the care team needs to understand that. The goal is not to make the family sound perfect. The goal is to describe the care need honestly. Number 4, understand how PACE may change the way care is delivered. This is one of the most important warnings in the whole video. PACE is coordinated care. That can be very helpful, but it also means the person may receive care through the PACE organization's team and network. So before enrolling, ask what doctors, pharmacies, specialists, transportation options, adult day centers, and home services are involved. Do not assume the person can keep every current provider exactly the same way. Do not assume the pharmacy arrangement will stay the same. Do not assume the family can keep using every outside service without checking first. Here is the question to ask. If we join PACE, who becomes responsible for coordinating primary care, specialists, prescription drugs, transportation, and home support, then ask, which current doctors or providers can my parent continue seeing, and which services must go through the PACE organization? This is especially important for prescription drugs. If someone joins PACE, prescription drug coverage is handled through PACE. If a person joins a separate Medicare Part D drug plan while in PACE, that can create serious enrollment problems and may lead to being disenrolled from PACE. So write this down. Before changing any drug plan, ask the PACE organization first. Pause. That one step can prevent a major mistake. Number 5, know who should check this now. You should ask about PACE if any of these situations sound familiar. A parent is still at home, but the family is worried they are no longer safe without more support. A spouse is doing nearly everything and is becoming exhausted. An older adult has repeated hospital visits, falls, medication problems, or worsening chronic conditions. A hospital, rehab center, doctor, social worker, or case manager has mentioned nursing home level care. The family is looking at nursing homes because they do not know what else exists. The person has Medicare and Medicaid, or may qualify for Medicaid, and needs coordinated long-term services. The person wants to remain in the community, but ordinary doctor visits and occasional family help are no longer enough. If that is your situation, do not wait until the final discharge meeting to ask. Call earlier. Ask the local Medicaid office. Ask Medicare Resources. Ask an area agency on aging. Ask the hospital discharge planner. Ask whether there is a local PACE organization serving that address. And if there is no PACE program in your area, ask this next. What home and community-based services are available here instead? That question matters because PACE is not the only possible resource. Some areas may have Medicaid home and community-based services, area agency on aging programs, caregiver support, transportation, meal programs, adult day services, or other local long-term care options. The point is not that PACE always solves the problem. The point is that families should ask about community options before assuming a facility is the only path. Number 6, use this call script. If you are calling for yourself, you can say, I am calling to ask whether PACE is available in my area. I am over 55, I may need nursing home level care, and I want to know whether I can be assessed for services that may help me remain in the community. If you are calling for a parent, you can say, I help my parent manage care. We are worried they may need nursing home level care, but they want to remain in the community if it is safe. Does a PACE organization serve their zip code, and what documents do we need for an eligibility assessment? Then ask these 5 questions. Question 1. Does PACE serve the zip code or county? Question 2. Who decides whether the person meets nursing home level care? Question 3. What Medicare and Medicaid coverage would be coordinated through PACE? Question 4. What would the monthly cost be based on Medicare, Medicaid, or private pay status? Question 5. What happens to current doctors, drug coverage, and outside services if the person enrolls? Write down the name of the person you spoke with, the date, the phone number, and what they told you to send next. Keep copies of records. Keep medication lists. Keep hospital discharge papers. Keep diagnosis information. Keep the Medicare and Medicaid cards nearby if you have them. And if they say you are outside the service area, do not stop there. Ask whether they know the closest program or other local home and community-based options. Number 7. Understand what PACE does not mean before you sign anything. Let me say this plainly. PACE does not mean every senior gets free home care. PACE does not mean every nursing home situation can be avoided. PACE does not mean Medicare alone pays for unlimited long-term custodial care at home. PACE does not mean the same services are available in every county. PACE does not mean instant enrollment. PACE does not mean you should cancel your current plan, change drug coverage, or move your parent before talking to the correct office. PACE is a real program, but it has rules. The address has to be in a service area. The state has to certify the nursing home level care need. The person has to be able to live safely in the community with support. The care team has to assess the needs. Costs depend on Medicare, Medicaid, and local program rules. Those details are not small print. Those details decide whether the program fits. So before signing an enrollment agreement, ask these questions. What happens to my current Medicare coverage if I enroll? What happens to my Medicaid services if I enroll? How are prescription drugs handled? What if we disagree with the care plan? What if my parent's condition gets worse? What happens if my parent later needs nursing home care? Can my parent leave the program, and what would the transition look like? These are not negative questions. These are responsible questions. A good program should be able to explain the process clearly. Number 8. Make the family decision with dignity, not panic. PACE is not only a benefits question, it is a family care planning question. A nursing home decision can affect independence, safety, finances, transportation, caregiver stress, medical coordination, and family relationships. Some families truly need facility care. There is no shame in that. A safe, well-chosen facility may be the right answer for some people. But before making that decision, families should know whether a community-based coordinated care option exists. So do not ask, can we avoid a nursing home no matter what? Ask a better question, what is the safest level of care? And is there a program like PACE that can coordinate that care in the community? That keeps the conversation honest. It protects the older adult's dignity. It also protects the caregiver from trying to carry the whole system alone. Here is the final picture. PACE is a Medicare and Medicaid-connected program for certain older adults who need nursing home level care but may be able to live safely in the community with coordinated support. The key checks are simple: age 55 or older, local service area, state-certified nursing home level care, and safe community living with help from PACE. PACE may include many kinds of care, including primary care, prescription drugs, home care, adult day services, transportation, therapy, social services, and nursing home care when necessary, but the care team decides what is needed under the care plan. It is not available everywhere. It is not automatic. It is not a guarantee someone can stay home forever. And it is not something you should join without understanding doctors, drug coverage, costs, Medicaid, Medicare, and the local care network. Your action step is simple. Pause for emphasis before moving into a facility or before assuming a facility is the only option. Ask whether PACE is available in your area. Use the words PAC and nursing home level care when you call. Ask about the service area. Ask about the assessment. Ask what documents are needed. Ask how Medicare and Medicaid would work together. If this helped you, subscribe for more plain English senior benefits alerts. And please share this with someone caring for an older parent, spouse, neighbor, or friend. One careful question before a crisis can open the door to options a family did not know existed.